Welcome back. A murder suspect who escaped last year from Washington's largest psychiatric hospital pled not guilty this week to torturing a Lake Stevens woman to death. Anthony Garver's escape shined a spotlight on security lapses at Western State Hospital. And in fact, the Associated Press revealed at least 185 patients had escaped or walked away from the hospital in just a 3.5-year period. Joining me now is AP investigative reporter Martha Belisle, who has been tracking this story for just the last couple of years. You have a lot of insight on this. We really appreciate you joining us.
Thanks for having me.
What kinds of things has Western done for the safety of both staff and patients in the wake of Garver's escape?
Well, soon after the governor replaced the CEO of the hospital, they implemented some changes where they shut down different access areas, and the Department of Corrections also went in and did a big investigation into what happened, and they found, that was the big report where they found 25,000 master keys were missing, and there were tools that could be used to open windows that were just left out, and so there were a lot of things that they highlighted, and the hospital made changes around those.
And you have, as we've mentioned, you have followed this for quite some time, and there's more that you have uncovered. In December, you reported a staffer was charged with molesting 4 patients. In October, you reported a nursing assistant had unauthorized photos of a patient on her mobile phone. Western State has until April to prove to federal officials that things have gotten better, or they risk losing federal funding. So in the wake of all of these things happening, where does this go from here? Do you think they'll be able to get a clean bill of health?
Well, they need some help from the legislature, and that's what they're working on now. There was a committee that investigated or looked at, a legislative committee, bipartisan, looked at a lot of the problems and tried to figure out, well, what needs to happen. And one of the things they identified was they need more staff, obviously. And they sent a list of recommendations to the governor, and hopefully some of those will go into effect. And they need more money.
They need more money, and there's another bill in Olympia that would give, they're thinking about giving that money to community hospitals. The idea being that maybe lower risk patients could be taken in by the community hospitals, maybe lessening the burden at Western and Eastern, which is just outside of Spokane. Will that help? Do you think that's a good solution?
Right. Western State Hospital takes care of civil commitments and forensic patients, people who have been charged with crimes. And so the idea would be to take some of those civil commitments, people who have been deemed a danger to themselves or others, and who are not really considered dangerous, and take care of them in some of the community hospitals. And it could help, but it's something that's going to take some time. They have to figure out the certification process. They have to find the hospitals who are willing to take these cases on. Some hospitals take on short-term civil cases, but they're the longer-term, the 180-day cases, and sometimes those are just turned over and repeat. So they have to figure out where those beds are going to be and approve the funding for it. So it's not something that will resolve everything overnight, but anything will help, I think.
If I may, you're an investigative reporter. I'm sure you've seen a lot in your career. You've been doing this now, this particular story, for 3 years. Are you surprised by what you keep finding? Has any of this shocked you?
It hasn't shocked me, but it's clearly disturbing and something that needs to continually be reported on, because it's important. It's important that it get fixed. I mean, there are staffers who have been assaulted. There are patients who have been assaulted. The system needs adjustments continually just to make it a safe place, and so that's why I keep reporting on it.
Why should viewers care about this? I mean, this is something that you can watch it on the news, and maybe people who don't live in those areas, who aren't impacted by it directly, may think, nah, this doesn't affect me. I would imagine that in some ways it impacts us all.
Well, it does, and also the federal judge who found the state in contempt for not taking care of the competency cases said that the state was violating the rights of the state's most vulnerable citizens, and they are. These are vulnerable people who are in vulnerable positions, who are needing help, and then they're in a situation where they're unsafe, or the staff are unsafe. So, so that's why we should care. These are people who need our help.
Martha Belisle, investigative reporter with AP. Really great information, and we really appreciate your insight on this story. Thank you for joining us. And we'll keep you updated in the developments over the coming weeks. Bill, over to you.